Hi, Miss AD. I'm Lori, a student, College of Coastal Georgia, and I'm going to be doing your abdominal assessment today. But before we get started, I have a few questions to ask you about your health history, okay? Okay. Have you noticed any change in your appetite the past 3 to 6 months that make you lose or gain weight? No? Okay, thank you. Any difficulty chewing or swallowing? No? Tell me, are there any foods that you cannot eat? Any that would cause an allergic reaction? You're allergic to any foods? Any foods that cause abdominal bloating, gas, distension, nausea, vomiting, diarrhea, indigestion? Okay. How about constipation?
No.
Belching? Do you ever experience any pain in your stomach? No? Okay, good. Any change in your bowels, in your bowel movement lately? How frequent do you have bowel movements?
Every other day.
Every other day, okay. And tell me what they look like, of the color and the consistency.
Brown.
Brown. And
Hard or sometimes soft.
Okay, when they're hard, do you sometimes take a laxative?
No.
You don't ever? Okay, good. Do you have any problems with a GI bleed? Any surgeries, abdominal surgeries?
No.
Any gallbladder spleen, jaundice, hernia, colitis? None of those things? Appendicitis? Any abdominal x-rays? No? Okay, good. Do you take any medications? Do you smoke? Drink alcohol? No? Okay, so went over those questions. I have, how about your eating habits? Let's go over those. I want to know what you had to eat for dinner last night.
Chicken nuggets, fries, and sweet tea.
Okay. And how about breakfast this morning?
Cereal and milk.
Cereal and milk, okay. And lunch today?
A sandwich, chips, and a bottle of water.
Okay, good. How about fruits and vegetables? How frequent do you eat fruits and vegetables?
Now, like every once in a while I'll eat them. Not that often.
How many times a week?
Like 2 or 3.
2 or 3 times a week. On that day when you eat them 2 or 3 times a week, how many times a day? Once or twice a week?
Yeah.
Twice a day you eat fruits and vegetables? Okay, so looking at your diet, you have a typical teenage diet, but you might want to consider adding more fruits and vegetables to help rid your body of chemicals, other chemicals. Like, you ever heard of antioxidants? They are in fruits and vegetables, and they help rid your body of those to help prevent diseases and cancers, okay?
Okay.
So from here, I'm going to do your abdominal assessment and see if everything checks out okay. Okay? All right, let's get. Okay. Because she's a female, we want to keep her body covered. Alright. We don't want to expose the whole body. We want to have the area that we're actually assessing exposed here. Okay, so what I'm going to do is look at her and inspect her. We have the abdomen is divided into 4 sections in which we have, they consist of the right lower quad, which has the appendix there. The right upper quad is where the liver is located. The left upper quad is the spleen area, and then the colon's in the left lower quad. But if we want to divide it into 3 sections here, we have the epigastric area, the umbilical area, and the hypogastric area, or either the suprapubic areas there. So what, for the purpose of this video, we're going to do the inspection to look at it and see is it raised, if she has any distensions, any mass, lumps or anything, and I don't see anything from here. But what I want to do is take and go eye level there and see if I see anything that's abnormal, and I don't see any indentions in her skin, everything looks fine from there. Looking at this, you don't see any abdominal scars or lesions, rashes on her abdomen. So the abdomen, the inspection, what I see has all been checked out. From here, I will auscultate and start with, I will take the bell of my stethoscope and listen. I want to be listening for the bruit up here and see, because she should not have any bruits. Let's make sure I have the right side. Okay, listen to the bell, and there are no bruits there. And so when I turn it back, I want to turn it back to the diaphragm area. And when I listen, I'm going to listen from the right lower quadrant, which is the ileocecal area, and they have the loudest vowel sounds there. Okay. Good. And so I listen there, and I hear the vowel sounds. Now, if she had hypo vowel sounds or absent vowel sounds, if I feel like they're absent vowel sounds, I would listen to listen to 5 minutes, and that's when I can actually say that I hear no vowel sounds. And she has good vowel sounds from what I can hear by listening to her. So I've done that. I've listened to her vowel sounds. Everything sounds fine. And now what I want to do is do the percussions on her and listen to see. When I do the percussions, I want to hear Tiffany. And Tiffany is like a hollow sound. And when I'm over a organ, then it'll be a dull sound. But that's what I want to be doing, listening when I do her percussions. And I want to percuss all 4 quads first. And then that sounds normal. Let's see. And do it counterclockwise. And listen for that. And everything sounds good there. After I do the percussions for her, I want to actually do locate the liver, where the liver is actually located. So I can either do this, take a deep breath for me, and I could feel the end of the liver, or I could do the hook method and have her take a deep breath, and then I can feel the end of her liver there. That's where I can locate her liver. So I want to measure actually measure the organ, and here, let's see, I would actually take and percuss from here till I hear a dull sound. That's a dull sound. And I would mark that area. And come from the bottom up. That's the bottom up. Okay. And then I would take my measure and measure centimeters. There, she's exactly 6 centimeters. So a normal liver should measure 6 to 12 centimeters, and hers was actually 6 centimeters. When I was doing that, I would the percussion. I'm going to make sure that I wasn't getting any other sounds. If she was distended or anything, then I would hear a dull sound, but I in there, but she's not distended or anything of that sort. So now from here we can actually start with the palpation. And then when I start with the palpations, I will actually do light palpations, and I'll start in each quad. Do you have any pain or discomfort? And while I'm doing that, I'm looking to see if she's having any garden while I'm doing this, and she's no change in her facial expression while I do that. And then from there, because she doesn't exhibit any guarding or pain here, now I can go and safely do deep palpation. And I will take my hand, and I'll take both of my hands and do this and assess any pain when I do that. And while I'm doing this, I am actually feeling to see if there are any enlarged organs. If so, if I did that, I would actually feel them. Especially if I felt here with the spleen. If it's enlarged, that means that I would actually feel it. And if it's there, it would be three times its normal size. And I don't feel any enlargement there with the spleen. So now I will actually palpate her kidney. And what I do is put my hand under here, making a duck bill, so I could palpate. Take a deep breath for me, please. And I'll feel the kidneys there. Good. And let's do the other side. And I'll have my hand like that. And you'll feel the kidneys right there when you palpate there for it. So now I will actually I want to look for the Murphy sign there. And I want you to take a deep breath. And when she do that, you feel any pain there? No pain? Okay, good. I'll do that. No pain. Okay. She doesn't exhibit any pain when I do those tests right there. Now I can assess for ascites. And what I want to do is, can you put your hand right there for me, please? And then I want to test for ascites, and that would show if she had any fluid, extra fluid that should not be there, and I do that, you would see the wave-like in her abdomen when it'll be waving. So she doesn't exhibit any waves there when I do it. So there's no sign of ascites. Thank you. No sign of ascites there. Also, I want to do the rebound test for her to tell me if she has a problem with her appendix. So what I would do is actually do that on the side, on the left lower quad. I would actually go down in there and come back up. If she had a problem with her appendix, that would actually cause pain. Another way to attest for appendicitis is I'll elevate her leg here, and I'll press down, and that pain would actually radiate up to that site right there, the right lower quad. Any pain there when I press down on your leg? Okay. All right, thank you. And she doesn't have any pain there, indicating there's a problem with her appendix. Now, the last thing I will actually do is test her aorta to find the pulse. And when I do that, I will look at the midline here and do a little pinch. Take a deep breath for me, please. And you can actually feel the aorta. Take a deep breath again. You can actually feel that pulse in the aorta there. So that completes my abdominal assessment on Miss AD. Thank you.